Hello guys, how are you doing? This is another episode of the Broshi Show. And today, our episode is going to be very interesting. We have a guest in our midst. I'm not going to do the talking. I'm not doing anything today. In fact, someone is here to do all the talking for me. If you are new to the channel, kindly subscribe. Click on the bell for all notifications. And then you leave your comment at the comment section. It is very important. Whatever that we are going to discuss today on today's episode, you can ask questions at your comment section, and then I'll be glad to answer your questions. Audience, I present to you someone so special from an organization with the name St. John Ambulance, and he's a senior trainer at St. John Ambulance. Let's welcome Mr. Richard Ni Ajay. Ajay. I hope I'm right with your name.
Yes.
You're welcome to the Precious Show.
Thank you very much, Beatrice.
I'm very happy to have you. It's not easy having you on board.
Right.
Yes. Thank you so much. You know the purpose why you are here today on the Precious Show.
Yes.
It's all about first aid. And I believe you have the best first aid training in the whole world. Oh, is it true?
Sure.
We thank God. On that note, take me through St. John's Ambulance. Who are they?
Well, thank you very much. St. John Ambulance was established in Ghana in 1937 by then British police to start an emergency services. Currently, it's under the Ministry of Health as an subvented organization to operate as a first aid training, ambulance service, and services. So this is St. John Ambulance for you.
Okay, that's nice. So, what is all about your company? What training do you offer?
We offer first aid training to everyone, institutions, individuals, churches, whoever needs first aid, we give it to them. Actually, we want to every house to at least get one person to be a first aider so that we save life.
That's nice. That's nice. Thank you. Thank you for taking me through St. John Ambulance. On that note, first aid, the word first aid, I believe a lot of people know the word first aid, but do they have idea about first aid? Do they understand it? Take me through first aid. What do we mean by first aid?
Okay, thank you very much again. First aid simply means immediate help or care we give to an injured person, a sick person. Suddenly somebody is ill. What to do to give the person before taking the person to the hospital with the help of available materials.
Okay. So the available materials, if I should understand what you are saying, the available materials. What are those materials?
Yes, sometimes when incident happens or somebody is injured, we try to follow the first aid box because of the contents, the items in the first aid box. Because we know gloves, we know bandage, we know scissors, we know gauze. So when incident happens, because there's no first aid box around, people feel reluctant to help the station in the case of blood and other things. So we are saying available materials because when you acquire first aid knowledge, we are thinking you acquire a skill, not necessarily having materials or first aid box available. If you have the skill and the knowledge, just swift application of common sense. Think of any materials available to help the situation you find yourself.
Okay.
So your whole cloth, handkerchief, whatever you have on yourself can help the situation to help others, depending on the person's situation.
Oh, that is nice. That is really nice. And So it means that first aid is very important,
Sure,
right?
it's very important.
So it's important for us to have the knowledge, or do we need to have the practicals as well?
Sure, that is a skill.
Yeah.
That is a skill each and everyone needs to have.
Okay. Okay. So how is first aid very, very important to us?
Well,
As
it's very important to save life. Your intervention of giving first aid, meaning you want to save somebody's life. But remember, when you want to save life, your life also is what paramount. You need to save your life first before others. Because when you are going to save somebody and the place is not safe, that means it's not safe for you to help the person. Also, with the aim of helping the person, you need to what? Prevent the person's condition from worsening.
okay.
Don't go there and do any other thing in the name of giving first aid, but rather follow the steps and procedures of giving first aid and be objective about it in reducing the person's situation. Also, you need to promote the person's recovery. Make sure whatever you are doing on the person will reduce the person's pain and promote his recovery.
That's nice. That's nice. It's really, really nice. It shows that we need to learn more about first aid. I hope you've already started enjoying yourself and we are learning something new today. Me, myself, I'm learning something new today. Do we have types of first aid?
Well, first aid depends on your location, where you find yourself, where it happens. Swiftly think about the materials available, then you apply it. At work, there may be a first aid box. You can rely on the first aid box with your skill and knowledge, then you help the person. When it happens in town, you think about the situation. Whatever materials you have, you deal with it. At churches, even in the farm, wilderness, you apply the available material there to save the situation. So for us having types, it depends on your location where you
Okay.
find yourself.
Okay. Okay. So it depends on your location. Does it mean that we don't have types of first aid?
I can't say we don't have types, but like I said earlier on, swiftly applying common sense in giving first aid.
Okay. 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 All right. So we as an individual, can we be a first aider?
Sure, everyone can be a first aider, no matter how your age, who you are, you can be a first aider.
Okay. 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 So on that note, I'm taking you straight to organization. Do organization needs to have first aid box at their workplace?
Yes, of course. And to add to it, with the Factories Inspection Inspectorate Act, at 368, Section 28, says that at least every organization should have one person to be in charge of a first aid box, meaning that person needs to attend to any injured person in the organization. So yes, an organization needs to have a first aider,
What of home?
any place. So
Any
we are propagating that at least every home should get one first aider to help in case of emergency situations.
Oh, okay, okay, okay. On that note, there's this question I really want to ask you.
Okay.
It's very important. I think a lot of organizations make those mistakes. Not only the organization, though, but then our homes as well. You spoke about first aid box. Is that not it?
Yes.
So first aid box, there are things in the box, right? What are the things that needs to be in the first aid box?
Right. You get your box first. It shouldn't be something that water can get into it. Could be wood, it could be plastic. Then you have your scissors, your dressing materials, which are the bandage, gauze, the triangular bandage, then plasters, without medication. Without medication.
Can you please repeat that place again? Without medication.
Without medication.
So it means that we don't have to put drugs in our
in our
first
first
aid
aid
box.
box.
Why? Why?
Because when it is a company, I can take a medication that will work for me, for my system. You can take and you react to the medication, which is not right, unless it has been prescribed for you before you can put in the first aid box, which is only or solely for you alone, your personal first aid box, or a family first aid box, which your wife knows about his or her sickness, your husband know about his or her sickness, they know the kids' sicknesses, so they can put it there in case of any injury or occurrences. They can fetch the medication and give it to them, only if it is prescribed by their doctors. But for company first aid box, we don't put medication in the first aid box.
Audience, over to you. We don't have to put drugs in our first aid box. I'm a health and safety manager. So in case something happened to someone in the workplace, or maybe headache, sometimes they will just rush to the health and safety manager office. Please, I have a serious headache. Do you have Paragon?
All right. That's why most companies require medical history of each and every worker, so that they will know their medical history or conditions. If something like that happens, they can keep medications there in case of that. And the person that is going to take charge of the first aid box must be well aware of the expiring dates of the items and the medication.
Okay. Talking of expiring date, the items that you do put in the first aid box, you didn't mention the items. Can you repeat the items that is required by a health and safety person, or is it required by health and safety person? No, that is not our job,
Yes,
right?
yes.
So it's required by St. John
Not
Ambulance.
St. John medical practitioners as a
So,
whole.
okay, good. So according to you, a first aid trainer, is that
Yes.
not it? You're a
Yes.
senior trainer.
Yes.
What are the materials that is supposed to be in a first aid box?
If you have your dressings, which are your bandage, your gauze bandage, can be in the wax forms or the roller forms. You can have your triangular bandage, your scissors to cut. Then you can have your GV bends. You can have your junction violet for abrasives, small wounds. Then you can have your pins, safety pins that can grip the bandages. If you have this, you are good to go.
So that one, it means that it's a complete
It's a complete first aid box.
Okay. It's a complete first aid box.
Yes.
Please, those watching, no one should rush to health and safety manager office and say, I'm not feeling well. I'm the health and safety manager, so you need to give me a drug. I have headache. Health and safety people are not doctors. They don't prescribe drugs. Thank you. Thank you, Mr. Ajay. I just love your name.
Thank you.
Mr. J. Okay, on that note, there are a whole lot of things that people have heard about first aid. People have their own perception, and I'm happy that you did explain some of the things for us to understand. Talking about not putting drugs in the first aid box. Not putting drugs in the first aid box is very, very important to me. It's something I really want to know, whether it is very, very important for us. Not even para. Are you saying that even para, we shouldn't put it in our first aid box?
It depends. If some people abuses paracetamol, so it has been advised not to put it in the box.
Okay.
Yes.
So you did mention that every home, every organization needs to have a first aid box.
Yes.
Is that not it?
Yes.
It means that we have to get people to control the first aid box.
Yes.
Okay. So those people, what is their name? What name do you give to those people?
If they undergone a first aid training,
Okay.
then the person can be a first aider.
Okay. If the person has undergone,
Gone a first aid training.
okay, then
And
the
they are
person can
certified.
be. Okay.
So you have a first aider in your home.
Okay. Okay. In my home,
Yes.
am I going to train my dad? Oh.
And then you have to come to us.
Okay. So it means that I have to bring my dad to.
Or you can be trained
Mm-hmm.
as a first aider, get the certificate. When you get home, make sure that you share the knowledge to them,
Okay.
because you can also be a victim. When you are a victim and they are not trained, they can't help you. But when you get the training, you come home, you train them, they can help you when you need that care.
Okay.
So we share knowledge of first aid.
Okay. So as soon as the person is being trained, then the person can manage the first aid box.
Exactly.
All right. Thank you so much. I believe there are terms that you use. You know your terms. Unconscious breathing, and then unconscious not breathing.
Yes.
Is that not it?
Yes.
So I want you to demonstrate to the world.
Okay.
Or before you demonstrate, if you can talk something, just a summary about this unconscious breathing and then unconscious not breathing. It looks very similar to me.
Yes.
I don't know the difference.
Very confusing also.
Mm.
Unconscious breathing. First, unconscious means you are unaware of your surrounding. And so many things can happen. Someone can go unconscious. Somebody can pretend to be unconscious. You call the person and the person will not respond. Somebody can take drug overdose and the person can be unconscious. Somebody can get injury and the person goes unconscious. Somebody can get heart attack and the person can goes unconscious. Somebody can get burns, severe burns, and the person can go unconscious. Hypoglycemia, the person can go unconscious. Asthma, the person can go unconscious. So many conditions. Now, unconscious will happen when the brain is not receiving circulated blood into the brain. Within 4 to 6 minutes, the person's brain cells will start dying. You understand? So when this happens, the person's brain is not receiving oxygenated blood within 4 to 6 minutes, and you are not quick to reverse that situation, the person's brain cells will die. Now, before you know as the person is breathing or not, you need to go through certain steps. First, you, the first aider, need to get close to the person and check for responsiveness of the person by tapping the person's shoulder, calling the person's name. If the person is not responding, then you have to pinch, like inflicting pain to the person's earlobe. If the person is not responding, we term that as unresponsive. Then you need to move forward, then you open the person's airway. We open airway because the person relaxes, the muscles of the person will relaxes when the person goes unconscious. So the tongue also becomes relaxed because the tongue is also a muscle. It can relax, fall back, and block the air passage. It can be partial or total blockage. When it's partial, sometimes people snore. When they snore, meaning the air passage is partially blocked with the tongue. Foreign objects can also block the air passage, preventing oxygen into the lungs. So you have to open the airway by placing your 2 fingers at the chin and your palm on the forehead, then you raise it back. Then you check for breathing for 10 seconds. When you check for breathing and you realize the person is breathing but still unconscious, then you, the first aider, needs to place the person in a very comfortable position we call recovery position, so that it will accelerate the person's breath. In case there's any foreign object or fluid, saliva in the person's mouth can drain down, and also stabilize the person and maintain the person's airway.
Okay. So you spoke about if the person is unconscious, you have to tap.
Yes.
Is that not it? You
Yes.
have to pinch the
Yellow.
the tapping. Which one?
The
Am I
shoulder.
tapping very
Let
hard?
the person feel somebody is touching.
Is it
Tapping.
touching or
You
tapping?
tap, but it should be deep.
It should be severe.
Severe one.
Okay. Very severe.
Severe one. This time we don't pour water. Pouring of water is unprofessional. So just tap and shake the shoulders. Call the person's name. Let the person feel the voice. Then you pinch. After pinching, then you declare the person unresponsive.
Okay.
After declaring the person responsive, you open the airway to check if the person is breathing or not.
Alright.
You can also place your palm on the person's diaphragm to check the up and down movements of the diaphragm. Within 10 seconds,
Before you continue,
yes,
you said diaphragm.
diaphragm.
Is it everybody that knows diaphragm? No.
Diaphragm is just a place beneath the stomach. That is, it deflates and
Okay.
so that's that. You place your or the stomach. It will, how you breathe.
Okay.
The going in and coming out of the stomach, it will detect that this person is breathing or not. So if the person is breathing quickly, then you place the person in the recovery position, even though the person is unconscious.
Okay. Alright. So have you differentiated between the two?
No,
Yes.
we are only dealing with unconscious breathing.
Alright. Are you going to?
Yes, I'll do that. Unconscious, not breathing.
Yeah.
The same unconscious, but when you get to the breathing stage, you check for breathing and the person is not breathing. That one, we are not going to do recovery position, but rather you make the person to breathe by applying CDR, cardiopulmonary resuscitation.
This is a word that is very common. Is that not it?
Yes.
It's very common. I know. Somebody may also know.
Yes.
Is that not it?
Yes.
Can you demonstrate it to us?
Yes, of course.
All right. Over to my production team. Mr. Richard Ni Ajay is coming to demonstrate whatever that he spoke about. The differences between the unconscious breathing and unconscious not breathing. Mr. J, which one are you coming to demonstrate to us?
I'm
Over
coming
to
to
you.
do unconscious but breathing.
Okay.
How to place that person into recovery position, and also it will maintain the person in a stable position. So it goes like this. First, you need to assess the person's where the person is, making sure there is no danger around the person that may endanger your life. After you've done that and the place is safe, go close to the person, then ascertain response from the person by tapping the person. At the same time, introducing yourself. Hello, sister. Hello, madam. Can you hear me? Open your eyes. Hello, can you hear me? The person is not responding to your voice. Then you pinch the person's ear to inflict pain. Watching the facial expression of the person is not responding. Then quickly, since the muscles are relaxed, open the airway to create space for the air passage. Then you check for breathing for 10 seconds. Had it been infection or COVID, I would have placed my ear or cheek to the nostrils. But because of COVID, I have to stay up, then check with my palm on the tummy to check the up and down movement of the tummy within 10 seconds. As you ascertain that that person is unconscious breathing, then quickly maintain the open airway Place the hand close to me in this position. Then pick this one. Place your finger into it, 5 to 5, to support the open airway. You interchange. Then you raise the leg upward first. Use the knee, press on the knee, then you turn the person toward your side. After turning the person, reposition the airway again to be sure the mouth is pointing down. You check for breathing for 10 seconds again. When you are sure the person is still breathing, you stabilize the body by placing this leg in this 90% angle. With this, it will be very difficult for the person to roll back. It has maintained the body. The mouth is pointing down. Any fluid in the mouth can easily drain down. The person can turn back. That is when the person has gained fully control over the muscles. So this is a recovery position for unconscious but breathing casualty.
Audience, what do you think? Have you learned something today?
Okay, the next one we are coming to do is unconscious not breathing. When somebody is unconscious and not breathing quickly, that person needs to be revived by doing CPR, cardiopulmonary resuscitation. So, not hesitating, immediately you call the person, you check for pain, there's no response, you open airway and you check for breathing. Within 10 seconds, and the person is not breathing, quickly shout for help. Locate the chest. Place the heel of the palm on the person's chest. Then straighten your elbow. You push from your shoulders. Then you give 30 chest compression. Formerly, it was 30 chest compression, 2 rescue breath. But now, because of COVID, we are going to avoid the rescue breathing and concentrate on the chest compression. Protocol also has been revised that solely chest compression can equally revive the person. So we are aiming at 100 to 120 within a minute. So it means we need to push harder, deep, to overcome the sternum and get to the heart. The heart is like our fist. We need to squeeze the heart so that blood will push flow to the blood vessels, to the other parts of the body. So it goes like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20. Whilst doing it, you watch the facial expression of the person. Any signs of life, quickly you stop. So we continue doing it until you get to exhausted or the person revives. When you call for help and the help arrives, you stop. So we'll try doing the CPR till you are exhausted. Keep doing it 100 to 120. So it goes like this. Beep, 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 beep. It shouldn't be too fast or too slow. So like this. Immediately the person coughs, you see signs of life, quickly you stop. Then you reassess or examine the person again. If the person is breathing, quickly turn the person into the recovery position and maintain the person's body. That is CPR. Thank you. Hope you learned something from CPR.
Mr. J, choking. I've heard of choking. Do you have anything for us on choking?
Sure. Choking comes as a result of foreign objects stuck at the back of your airway. Some people choke through their esophagus, but that can be removed very easily. But our main concern as first aiders is when you are choked at the air passage. You know, we have 2 pipes, the air passage and the esophagus. And there's a epiglottis that regulates the tubes, which is the windpipe, then the esophagus. You know, food passes through the esophagus into the stomach, and the oxygen that we take in pass through the windpipe into our lungs to operate. Now, when you are eating and you are talking at the same time, the epiglottis can get confused. Epiglottis that regulates the two pipes can be confused because you are doing two things at the same time. So mistakenly, food can get into your air passage. That can make you choke, right? When it gets to your esophagus, that one you can drink water or take a bigger blow of what you are eating, then it will push it to your stomach. But when it gets to your windpipe, it's very difficult. It can partially block your airway or totally block your air passage, making you difficulty to breathe or difficult to talk. Sometimes you see the person suffering, the person cannot talk, but rather holding on the throat, pointing at the throat, right? So when you see such person exhibiting these signs and symptoms, you as a first aider, quickly you have to jump in and care for the person by dislodging the object. So when you want to dislodge the object, quickly stand behind the person, encourage the person to cough because naturally the person will start coughing because of the start of the air passage. Then cough for me, madam. Let me help you. Make sure your airway is open. Cough, right? Then you stand behind the person, thing like this for me. Can you cough in between? Then you place your arm on the person's diaphragm like this. You allow the person to bend a bit. In between the shoulder blades, you use the heel of the palm, then you hit, then you slap 5 times. Cough, please, cough, cough. Slap, then you push, cough, cough. If you don't succeed or the object is not dislodging, quickly you do abdominal thrust. Stay behind the person, use the hips of the person, locate the navel. On top of it, you make a fist, then you interlock, then you push, then you scoop. You push, then you scoop 5 times. So you do this 5 times, this 5 times. If you don't succeed, quickly try and send the person to the hospital. Now with the abdominal thrust, you don't have to do it on a pregnant woman or a pot-belly person or somebody who has undergone a cesarean section around the abdomen, right? So you apply the back blows, the abdominal thrust to relieve the object at the throat. But you need to be mindful of sending the person to the hospital. The object will be removed. So this is choking demonstration for you.
Thank you so much, Mr. J. Thank you so much. Mr. J. Or is Ajay?
Ajay.
Ajay.
Yes, Ajay.
Typical guy.
Typical guy.
Okay, 100%.
Sure.
Mr. J, your final word to my viewers.
Okay. I would say everyone needs to be trained in first aid. So as every organization needs to at least have one first aider to be responsible of all injuries that will arise at the workplace. Every home, wherever you find yourself, at least there must be a first aider in case there is first aid or injuries around. It can be taken care of. Let's all do this to save the situation in Madagascar. Thank you very much for having me.
Thank you so much. Thank you so much. Is it only for Madagascar?
The whole wide world.
Thank you. My show is not for only Ghana. It's for the whole world.
Yeah.
Wherever you find yourself, you are watching the Precious Show. I hope you've learned something new today. He has imparted a lot of knowledge today. I've enjoyed myself. I believe you've also enjoyed yourself. I've learned something so much important in today's episode. We shouldn't put drugs in our first aid box. In our organization, please, we don't have to put drugs in our first aid box. It applies to our homes. Please, don't try it. You are not a doctor. I'm not a doctor. He is not also a doctor. On that note, that brings us to the end of today's episode. I have to thank my sponsors, but before I do that, I have to give a very big thanks to St. John Ambulance. Thank you, Mr. Ni Ajay, for coming to the Proshi Show. I said, God bless you. And God bless you for impacting knowledge to the whole world. May God bless you. On that note, if you are new to the channel, kindly subscribe. Click on the bell for all notifications. Don't forget to leave your comment at the comment section. My sponsors, Christy's Makeover. She's back. I'm looking so beautiful this evening. It's all balls up to Christy's Makeover. She's having a class which is coming on 22nd of March. Do well to register, and then you have your certificate. My second thanks goes to Bodyline Clothing. Bodyline Clothing. Please, those who said they need exactly dress that I was wearing last week. The muffler is for me. They gave the shirt. So they don't sell both together. I'm begging you. This shirt is from Bodyline Clothing. Contact them and then you get a nice office wear to wear. My third thanks goes to Tochi Beauty Salon. They are saying they want to spoil me with hair. And then I'm also ready to advertise Tochi Beauty Salon. Tochi, Oga, thank you so much. Thank you. God bless you for a beautiful hair that you've given to me. And then the last person, which is Mobile Laser. Mobile Laser, you want your teeth to be very white. Then it's Mobile Laser. Mobile Laser, they'll be at your doorstep to whiten your teeth for you. Unless I forget, forgive me. Sam's Stationery, please contact them for nice stationery. Thank you. Until then, the name is so simple. Beatrice Labi. So, Mr. Ni Ajay, thank you so much for coming to the Proshi Show. I appreciate your time. And this is from the Proshi Show to you, Mr. Ajay. I hope I'm right.
Yes.
Over to you. Thank you and God bless you.
Okay. Thank you very much. I'm honored.
You're welcome.
Thank you.
You're warmly welcome. Until then.